Hey everyone, so in this video, I'm going to talk about Medicare costs in 2024 and specifically how they affect the Medicare beneficiary. We'll be going into a little bit more on the nuances of the changes in Medicare Part D, because in 2024, actually, Medicare Part D, the drug plan, got a whole lot better because they've capped the total amount of spending that you will have if you use the Medicare Part D program. But there are some ways and different ways that you can hit that cap, and it's not a solid figure like a dollar amount. It's kind of like a combination of a bunch of things, which is we'll get into it in this video. So let's start. So the changes in Medicare costs in 2024, and this is from the Medicare Interactive, MedicareInteractive.org. They're a funded organization that helps educate beneficiaries. I'm not in any way affiliated. So limits on the Part D drug plan. So Part D drugs have 4 phases. In 2024, the last phase, which is called the catastrophic phase, is technically going away. So when you reach the catastrophic phase in 2024, you have a 0 cost sharing amount. In the past, and they say here, you would have owed 5% of the total cost, even reaching the catastrophic coverage phase. So just to reintroduce everybody to what that sounds like, I have this wonderful what it looks like. There we go. So the first phase is the deductible phase. And in the deductible phase in 2024, the highest the deductible can be for Part D drugs is $545. At this point, if you have a deductible in your drug plan, you pay all of the costs and your insurance pays for nothing. Now, during the initial coverage phase, this is where the listed copays for tier 1 through 5 medications is what you'll have to pay. And in this part, you'll be paying for, or you have about $5,000 of coverage. Now, this coverage includes both what the insurance company pays and what you're paying. So if your drug costs $100 and your copay is, let's just call it 25, then that 25 from you and the 75 from the insurance company is added together and is taken out from this $5,000 benefit bucket, we'll just call it. Once you have passed that initial coverage amount, you go into the coverage gap, which is also called the donut hole. And at this point, you are paying for 25% of the drug cost, and the pharmaceutical company discounts 70%. Now, the strange part here is that the way to get out of the donut hole or the coverage gap is to have spent out of your own pocket $8,000. Okay, that $8,000 amount is calculated based on all the money you spent here. So your deductible, if you had a deductible, plus your part, the member's part of whatever you paid in the initial coverage, plus whatever you're paying here and the pharmaceutical discount. So the true out-of-pocket cost, which is what TROOP stands for, is not really the true out-of-pocket cost that you spend. It's pretty much whatever the drug insurance, the Part D plan, didn't pay, right? So because the pharmacy company discounts 70% of the cost, that cost is added then to the $8,000. So the kind of number that experts have agreed upon or settled upon is about $3,300. So if your out-of-pocket cost for Part D drug plans reaches about $3,300 in 2024, you should reach the catastrophic phase where you don't pay anything. Okay? So if you didn't understand that, just rewind the video and you can watch it again, because it's important for those people who are spending a lot of money on drugs, or if you are worried about hitting that maximum or hitting that kind of catastrophic phase or the donut hole with drugs. Now in 2025, hallelujah. Let me kind of get this a little lower so you can see. In 2025, the out-of-pocket drug costs will be capped at $2,000. How they're going to afford to do this, I don't know. So please, please, please reevaluate the drugs that you're on and the plan that you're on for the plan year 2025, especially because this program is going to be new. And the drug plans might find ways like either boosting the premium up to and triple of what you've normally pay, or they might knock off some of the drugs that you take. So please check. All right, one of the good things for people who are, who need a little bit extra help program was expanded. Now, in the past, the extra help program had different layers or tiers of extra help. Now, it's all one tier. So it's not like maybe you have an $85 deductible and a 15% copay. It's all the same, no deductible, and pretty much the old catastrophic coverage is what you're getting. And let's go see if they tell you how much you're going to pay. Yep. So all people who have extra help will get a $0 deductible, $4.50 copay for generics, and $11.20 copay for brand drugs. And of course, if you have Medicaid, it should be lower because Medicaid will kick in for some of these medications. If you want to know how to qualify for extra help, it is ssa.gov/extra help. And you can do a Google search and make sure it's the ssa.gov website and not some other .com or something where they might, it's not the actual site. All right, some reminders. So all insulins covered by the plan are limited to $35 per 1 month supply. And that's covered by Part D, or if you get your insulin through like a pump and you get it at like the doctor's office, different. Vaccines, all the vaccines that are covered by Medicare at a no copay. So before, shingles, remember shingles, you have to pay for that. Don't have to pay for that anymore. Very good. COVID-19, for those of you who are getting the COVID-19 vaccinations, those are also no copay. COVID testing, also, if done inside of a clinician's office, is a $0 copay. Part A. Most people, well, I guess I can't say most people, it's about 50% of people have a Medicare Advantage plan. So Part A costs will look a little bit different, and the Part B costs will look a little different from what you probably have. But for those of you who are on original Medicare or original Medicare with the supplement plan, these numbers are pretty relevant for you. Now, Part A, most people, this I can say most people, are premium free. That means they don't have to pay it. And the retail cost of Part A is actually quite high, $505. The deductible, that means if you get admitted to the hospital, a benefit period is 90 days. So for the first benefit period of 90 days, you have a $1,632 deductible. The first 60 days of that, you don't have any copay, daily copay, other than that first initial deductible. After that, though, you do have a daily copay. Again, most Medicare supplement plans, at least the ones that I recommend, will wipe this entire cost off your plate. So you don't have to worry about that. Medicare Advantage depends on the plan. Now, a lot of people ask what this lifetime reserve and stuff. You have 60 lifetime reserve days. What that means is if you're in a hospital for 90 days in a row and you still need to stay there, you tap into what's called lifetime reserve days, and there's 60 of them for your life. And that is a copay of $816. And what that does is it allows you to stay longer than the 90-day benefit period consecutively. Medicare supplement plans will allow you to stay in the hospital, will pay for your hospitalization for up to an entire 365 days. So it benefits you to get that. Medicare Advantage plans that I've seen also do not use up your lifetime reserve days. They shouldn't, because you're not on Medicare A anymore. But that's kind of how it is. So if you have a Medicare Advantage plan, you probably have more than the 90 days. Highly unlikely you'll be in the hospital for that long, but in the case that you are, For those of you in Part A, lifetime reserve days are tapped. For those of you on Medicare Advantage, make sure you check your plan. Nursing. All right, so for skilled nursing facilities, you actually need to be admitted to the hospital and stay there for a total of 3 nights in order to get this benefit. So it's not like you can just get sent there and it's free for the first 20 days. Typically, for people who have a skilled nursing facility admittance, they've already paid for the cost of the hospital inpatient deductible. So it's quite high. And after day 20, from day 21 to day 100, it's $240 a day. 100-day max is what Medicare will pay for. After that, they consider it custodial. Typically, they don't let you stay even past day 20. Part B. All right, so Part B, the standard for Part B premium is $174.70 a month. So $174.70 per month. And that's if you're making $103,000 or less in the year 2022, or $206,000 or less if you're married filing jointly for your tax returns. If you have higher income from 2 years ago, then you will have to you'll be responsible for what's called an IRMA, income-related monthly adjustment amount, and that amount is determined by whatever level of income you have. There have been people who've contested it and won, and contested it and lost. So sometimes because you retired from a high-paying job and you no longer are at that high-paying job, they will decrease your premium. It really depends on who you're talking to. It is a subjective thing. I've had one client who they told her that no, she should have saved the money, and another client who they completely agreed with and dropped his Part B premium back down to what his current income level was. Part B has a deductible. It's an annual deductible, unlike Part A, which is a deductible period, 90-day deductible. Next year, or this year, is $240 per year. After that, all of the Part B services are 20% uncapped, which is why a lot of people get a Medicare supplement plan or a Medicare Advantage plan to cap their maximum out-of-pocket responsibility. All right, Part D, drug costs. So the premium for 2024, the base premium is $32.74. And this also scales. If you have higher income, you have to pay an income-related monthly adjustment amount on the Part D. For those of you who have a penalty, the penalty of 1% per month that you were not enrolled when you were supposed to be, that penalty percentage is calculated based off of this rate. So if you have a 100-month penalty, that's 100%, you would be paying an additional $32.74 per month, in addition to whatever your Part D or Part C plan premium is. And typically you pay the premium or this penalty directly to the private company. So if you're a Part D plan, you pay it to them. If you have a Part C plan, you pay it to the Part C plan. If you qualify for extra help, though, it wipes out this this penalty completely. And we talked about the deductible. We talked about extra help. Phases. I like the model that I use before. So if you want to review the phases of Part D, you can go back to the beginning of the video and talk about that. Medicare Advantage is Part C, private health. Now this is going to vary. The costs are going to vary depending on your plan. What I'll talk about here in this section is how much the maximum out of pocket is for the plans. And the max out of pocket in 2024 is $8,550. That's the highest. Many plans that I've seen, the maximum out of pocket is much lower. Well, it's about $6,000 to $5,500. Sometimes if you have a plan that's more expensive, that number could be lower. But this is the highest that it can be as far as Part C Medicare Advantage plans. All right. That's pretty much it. Looks like I don't see anybody who is on the stream. So If you guys have any questions or want to learn more about a different part of the Medicare program, please let me know in the comments. You can also watch other videos on this channel about Medicare and retirement. If you do have any specific questions, please do leave them in the comments, and I'll do my best to try and create a video on that. All right, you guys have a great rest of the day. I'll see you in the next video.